You can now buy at-home wax removal kits with cameras, syringes, spiral tools, even little metal instruments designed to go in the ear. And here's the problem. You're only a few millimeters away from really delicate anatomy. One slip and we can take what could be a simple wax blockage into bleeding, an ear infection, and worse yet, damage to our eardrum, of which I've seen all of those things. And sometimes the bigger risk is what we think is just wax isn't wax at all. So before you put anything in your ears, here's what you need to know. Now, before we jump in, make sure to like this video and subscribe to our channel. My name's Dario Coletta. I'm an audiologist and doctor of audiology, and I've helped hundreds of people in the Toronto area to achieve better hearing and solve complex cases of hearing loss. And on top of that, I've performed thousands of wax removals using curettes, suction, and irrigation. And I've seen lots of people who needed and did well with wax removal. And I've seen many people who came in thinking they had wax and it was a much bigger issue. So let's dive in and learn exactly what we need to know. Now first, something a lot of people don't realize is earwax isn't dirt. Now we call earwax cerumen, and it's normal to have. And I tell a lot of people having some wax is healthy and normal. Just because we have some wax in our ears, it doesn't mean that we always need to clean it or remove it. Now, earwax serves a purpose. So it helps to protect and lubricate our ears, but also traps dirt and debris. So really think about earwax as a protective mechanism. And normally our ears do a pretty good job of cleaning themselves. Just as our ears naturally produce wax, it's going to slowly migrate the old wax out towards the opening of our ear canal, either to fall out or we wipe it away with a tissue or a washcloth. You almost want to think about your ears as like a tiny conveyor belt for earwax. Now, the problem starts when that process doesn't work properly or we interfere with that process. Some people produce a lot of wax. Some people produce more wax in one ear compared to the other. Wearing something like a hearing aid or an earbud for an extended period of time slows or prevents your ears from naturally pushing the wax out on its own. And some people just have smaller or more narrow ear canals, which put them at risk for more wax buildup or more easily for our ears to become blocked. And eventually you might develop a blockage. You may feel like your ears are plugged. You may feel like your hearing is muffled. You might even notice some ringing in your ears. And this is generally when people start Googling, how do I get this thing out? Now let's start with the obvious ones. We have the little scoops, the metal tools, the spiral tools, and yes, of course, we have cotton swabs. Now, of course, here the problem is you can't properly see what you're doing. It may feel great while you're using it, but behind the scenes, we don't know what's happening. And even when you add a camera on top of it, it doesn't magically make you trained to remove wax. Our ears are these dark and narrow places, and sometimes if an ear is not something we've looked in before, having an ability to gauge depth is very difficult. So what may look like something is very far away can actually be much closer, and the skin in our ear canals is very sensitive. And so it doesn't take much pressure or effort to bruise or make our ear sore, or worse yet, kind of bump a tool up against an ear canal wall and cause it to bleed. One small movement, someone bumps your arm or you sneeze, and that small tool is going to go a lot deeper than it's supposed to. So you scratch the ear canal, you push the wax in deeper, you create a full blockage. I can't tell you how many times people come in and said, I used a Q-tip after the shower. Now I already know where this story's going, and I blocked my ear and I just can't get it out. And in some serious or more serious cases, we can actually cause serious harm to the ear canal or our eardrums. Why don't I show you a few examples? So this is an example of somebody who came in, and classic example, they used a Q-tip after the shower. What happens? Well, we push the wax in too deep. And so now one, it's sitting much deeper in the ear canal than where our ears will actually produce wax. And so now the wax is just stuck. But we can also see that this wax is completely blocking the person's eardrum. So on top of a feeling of plugged or fullness, you're actually going to see a reduction in hearing because sound is not able to pass through that wax. And this is what it looks after we professionally took it out. We can see the ear is now clear of wax. We can see the eardrum that appears healthy. We can see all the traditional landmarks that we're looking for. And following this, I actually did a pressure test which told me how that person's eardrum is working. When we did it before taking out the wax, it was flat. We knew sound wasn't going through. Now it's healthy and working like it should. Here's another example. And I actually took a couple of before pictures. So when we're looking closely, we can again see a full plug. And again, this is not where our ear would naturally produce wax, so it's stuck. Now, I zoomed out a little bit, and we can actually see how far down in the ear canal the wax is sitting. Again, that's not a spot where our ears are going to naturally produce wax. That's been pushed in with a tool. And now if we look, a normal, healthy looking eardrum. We can see there's some remnants of dry skin, which can be very normal after taking out wax, but now we've gone from a fully plugged ear to a healthy looking eardrum. Now, home irrigation can look simple. Put water in, wax comes out, done. Let's talk about it. Here's somebody who tried an earwax removal kit at home. They put a little bit of oil in their ears for a day or two, and then they flushed it. Now, they came in feeling like they felt a lot better, but they still didn't feel as good as before the blockage started. And there's a reason. So when we look, we can see there's a lot of really soft wax around the perimeter of the ear. And so we can actually see part of the eardrum, which means it's not necessarily going to impact our hearing, but there's still a significant amount of soft wax deeper in the ear canal. So this is a prime example of, because we can't see what we're doing, we may get some relief, but we may not get all relief. And so as good as this person was feeling, they came in still feeling like they were a bit blocked or plugged. And when I looked in their ear, this is what I saw. Now, of course, we finished the job. We removed it successfully. And so we can actually see the ear is now clear. And again, the eardrum looks healthy. And as much relief as this person had when they tried an at-home kit, they felt 100 times better walking out the clinic door. Now, irrigation is tricky too because not everybody is a candidate for irrigation. If you have or might have a perforated eardrum, previous ear surgery, tubes, an active infection, or certain other ear conditions, introducing water in the ear canal may create additional problems. Now, when it comes to irrigation, there's a lot of factors that play a role. Technique. The goal isn't just to gush the ear full of water. It's about streamlining water in places where we think is going to be most effective. Temperature matters. If water is too warm or too cold, it's going to be really uncomfortable, but oftentimes you can feel some discomfort or dizziness. When looking at our professional tools, we'll often use a machine that actually holds the water temperature at body temperature. And so although it may still feel warmer in the person's ear, it should either reduce or prevent the dizziness or imbalance because of water temperature. Pressure matters, and you need to know what you're looking at before you start. And this is the part that I think a lot of people overlook. Not every ear that's blocked is caused by earwax. Something like a sudden hearing loss can feel simply like an ear that's become blocked with wax. And that's very different. If you suddenly lose hearing, particularly only in one ear, you don't want to spend the next 1 to 2 weeks trying an at-home wax removal kit when that's not going to solve your problem. You need to have your ear assessed. The same applies if you have significant pain, discharge, bleeding, severe dizziness, or other concerning symptoms. Sometimes the danger isn't the wax removal kit itself, it's delaying the correct diagnosis. Here's a prime example. This is somebody who thought they just had wax. They came in, I looked in the ear, no wax present. We did a pressure test. The eardrum was healthy and working like it should. We did a hearing test, and we actually determined that they had a sudden hearing loss that required an urgent referral to see an ear, nose, and throat specialist. Thankfully, they did the proper follow-up care and their hearing restored. So it's important that if you just suddenly feel blocked, it's not something we want you waiting on to see if it gets better. Make sure you take action quickly. And now we have ear candling. The idea that putting a hollow candle in your ear canal and lighting it, creating suction that pulls out the wax, it doesn't. There's no evidence to support that ear candling successfully removes wax or even impacted wax. And worse yet, you now have your ear and your hair all susceptible to an open flame. I often think about it. You don't see ear candling offered as a service in an ENT or an audiology clinic. Burns, hot wax, a potential obstruction, which sadly I've seen one too many times. I can count on more than two hands the number of times people have said they've gone in for ear candling and we look in the ear and it's plugged with wax. But not earwax, candle wax. So here's an easy one when it comes to ear candling. Don't do it. Yes, and this is where I don't want the message of this video to be, well, don't do anything with your ears without an audiologist standing beside you. For many people, wax softening drops can be really successful or a good first step. We just need to make sure that they're the right thing for you. If you have a history of eardrum perforations or ear infections or ear surgeries, or you're just simply not sure what's happening inside the ear, get professional advice first. And if the wax isn't resolving, well, don't escalate from drops to a spiral tool, to a camera, to a full excavation project of your ear. Get somebody to actually professionally look inside your ear. Again, here's somebody who came in thinking they just had wax buildup. They had a little bit of pain in their ear, no discharge, really no change in their hearing, which I was surprised by. And when I looked in their ear, this is what I saw, a hole. Now, who knows if the hole was there all along, if the hole was the result of at-home cleaning, but we found a hole. This wouldn't have been something where we wanted their next step to be, well, let me go and buy an at-home flushing kit. That wouldn't have ended well. When I assess someone with suspected wax, the first thing I want to know, well, is their wax actually there? How much is there? Where is it? What is the texture of it? What is the size and the shape of their ear canals? What does the eardrum look like if I can visualize it? And is there anything that would restrict a method of removal or make a method of removal inappropriate for this person? And that's going to come from a thorough case history and a pretty good understanding of the ear. And depending on the situation, I'm going to determine what is the best method for removal. Does that mean we're going to either manually remove it safely? Are we going to use suction or irrigation? Now, the important difference here isn't simply just the equipment. It's that we're assessing, or I'm assessing, the ear before we decide what to do. So are all at-home kits dangerous? Well, no. It's about assessing what's right for the person. But inserting tools into your own ear, aggressively irrigating it without knowing what's happening inside, or setting fire to a candle besides your eardrum, that's where a simple wax problem can become a much bigger problem. And remember, if your hearing suddenly drops, if your ear is painful, if it's bleeding, if there's discharge or dizziness, don't assume it's wax. Have your ears professionally checked. If you found this useful or helpful, like our video, subscribe to our channel, Cut the Noise, and send this to somebody who loves to use a cotton swab like they're performing microsurgery. And I want you to tell me in the comments, what is the strangest thing you've seen advertised or have tried for cleaning your ears. My name's Dario. This is Cut the Noise. I'll see you in the next one.